This next program is going to connect the dots for you between oral health and systemic health. But what you'll see with the new techniques is how infection in the mouth spreads all the way down through the chest, into the breast, into the arteries, into the heart, and intervention makes that go away.
Was dealing with a really aggressive type of leukemia, and basically been told in the States, you know, there's not much we can do, if anything. And he went to Dr. Darling, and it was amazing. And he had a root canal, and they pulled it, and it was just black and it was amazing. And he said when that got pulled, he felt like a key went in a lock and turned, and he was really given, you know, no chance of living.
No chance of living, and he walked out of that place 4 weeks later.
4 weeks later.
Did he do radioablation too?
No, he didn't, because he didn't have any tumors.
Oh, so he just got the root canal out.
He got the root canal, and he got all the IVs. Yes.
Wow.
Yeah, so for me, that, you know, to see my case and his case was just amazing for me. You know, to witness, those are two extreme cases.
That's amazing.
I mean, I was in stage 4 cancer.
And it's gone.
Mm-hmm.
It's gone.
And I feel great.
Yeah. Boy, I tell you, I was so pleased and so blessed to be able to find that, because I would have never, I don't know, never is a strong word, but I wouldn't have known about the whole root canal thing and my mouth, and because he showed me, and he looked, and you could see right all the red stuff around my mouth. Yes. He said, you should go see Dr. Nunley, because you got a lot of stuff going on there, kid. So that's how I got introduced to Dr. Nunley. I didn't know about any of this stuff.
And I know the medical profession feels I've lost my mind, and they're amazed every time I go back. They keep feeling it's coming back. My oncologist told me it would be back because I had invasive ductal carcinoma.
And when you look at Jeanette, you marvel first at her overcoming such a killer as pancreatic cancer, and second, at her doctor's seeming reluctance to tell her the good news. Give a second thought to Julia's case history. 3 months to live, transformed into the celebration of 2 more birthdays. And what a success story Ed tells. His victory over leukemia should be a source of great encouragement to all those who've been diagnosed with this dreaded form of cancer. Then there's Kathy, with her inflammatory breast cancer now a thing of the past. And finally we have Steve, who has rewritten all the rules of survival. He makes no sense, not as sense is commonly understood. Briefly put, he defied and continues to defy death, yet he lives a full and productive life.
This lady, 53 years old, she had breast cancer, 6 root-filled teeth, 4 of them happened to be on the breast acupuncture meridian. So what are her chances of not getting cancer? She also had amalgams. And that x-ray was passed by a top dentist and oral surgeons being okay. But, hey, even I can see the problems. Here's another one. Breast cancer, 4 root-filled teeth, 13 amalgams and 3 crowns. I get a patient with an abnormal thermogram that's deteriorating. She's heading towards breast cancer. And they've got that in their mouth. Ductal carcinoma, the nipple temperature had gone right up to over 1 degree, 1.3. So we intervened. We instigated measures which consisted of removal of the root-filled tooth. Had to be on breast meridian as well. She had her amalgams removed. She went on vitamin C, selenium, DIM, Mullimen, homeopathic. 3 months later, looking better. 6 months later, looking even better. Nipple temperature down to 0.3, so normal. So before March it was that, and 1 year later it was that. Basically by including some dentistry and a few other bits and pieces, but the main thing was dentistry.
I'm a year and a half later, and all of my blood work, everything is clear. So I'm very thankful.
And we have the Wellness Center to be thankful for. And I would just like to say to you, let's do this about 10 years from now again, and we'll see where we're at.
When she got back to the States, she went to Dr. Nunley, and she's having some stuff done on her mouth based upon what she saw.
Oh, good. Oh, you mean so she saw some things with the thermal imaging that Dr. Donnelly could connect up with the mouth, and then she could get the mouth taken care of.
Yep.
And then that would probably deal with these little...
Exactly. And actually, the root canal that I had was right on the breast meridian in your mouth, on my right side, and so that that's going down into your whole body.
Certainly, Dr. Huggins, he talks about that a lot as well.
That side of the mouth.
Which means that there's an infection in the bone there, and that infection will drain into the lymphatics in the rest of the body.
Wow.
That side of the mouth, the other side of the body is fine, and you can see it running down that stream of the body.
That's crazy.
Where the root canal is.
I know. And can you imagine how few people understand what we're talking, know about what we're talking about? Isn't that fascinating?
Well, I certainly did, and I wish I would have known it 9 years ago.